Unaona upande wa afya Kenya tunaendelea vizuri sana.
Burden actually is we see about 5,200 cases per year, and out of that about close to 3,000 or upwards of 3,000 deaths. So that really worries us because that translates to about 9 women dying every day. So really we are trying to work in collaboration with all stakeholders, and we're happy that we are even working with the county governments like Makueni to really emphasize the message around cancer prevention. And one of the major ways of cancer prevention is really to emphasize the issue of screening for all our women. We target women aged between 25 and 49 years. And we are quite concerned because from the last survey conducted about 3 years ago, we see that only about 16% of the eligible population have ever gone out for screening. And yet, these services are available across the country. They are available from as low as our health centers in the public sector. So we are really calling upon Kenyans at large to go out and get screened for cervical cancer, because by its nature, cervical cancer develops about 10 to 20 years after someone is infected with the virus, the human papilloma virus. So it gives us time to be able to detect it and do something about it. So this is really a call to action to all our women and our men as well, because we know that in our societies, men also have this, play a part in terms of the decision for women to seek care. So we really want to encourage all of us to be united in that message of mobilizing all our women to go out for screening, so that we move towards eliminating cervical cancer. All over the world, there's a push for global elimination for cervical cancer. And we have a very ambitious target. As part of the global community, we need to aspire to target about 70% of our women being screened. That's the only way we are able to achieve a cervical cancer elimination. So we appreciate that we have quite a lot of work to do, moving our coverage from as low as 16% to approach 70% is quite a bit of work. But we believe working together as stakeholders, as government, as civil society, churches, schools, everyone in society, we have a role to play so that we improve that coverage, so that we start seeing lesser of our women dying from cervical cancer. But probably one that has come out quite strongly is the nature of how the screening is done, because cervical cancer screening is a very invasive, procedure. Someone has to go and expose themselves, their private parts to a doctor. So that, I think, in a way, pushes women away from going for screening. But we have seen improvements in terms of the tests. Now we have newer tests that would allow a woman at the comfort of their home to actually collect the sample themselves. So we are shifting away from that traditional technique of people having to go to the hospital, to a technique that allows a woman to collect the sample themselves. Then that sample can then be transported to the lab, and then that can be evaluated, and the person can get results. So we hope that with adoption of such newer technologies, we'll have more of our women, taking up that. Taking up that test. I think the other thing that was associated with that is the issue of the whole stigma about cancer and cervical cancer in general, so that people sort of have that misconception or myths that cancer is a death sentence, which is not. So we're also working very closely with our civil society, and largely using survivors, those who have gone through this process, so that they can come out and encourage fellow women that it's possible. You can go out and get screened and actually get treated locally. And towards that also, we are also expanding access to treatment, so that when you move around the country now, there are a bit more places, centers that women can get treatment even for cervical cancer. We have up to about 10, county centers that are able to provide treatment services. When we talk about Mombasa, Meru, Nyeri, Nakuru, Kisumu, Kakamega. So I think we're also trying to make sure that even as we tell Kenyans to go out for screening, they also are able to access places near where they live, where they can get treatment.
Mwaka uliopita mwezi wa 10 tulianza kupeana kwa watoto ambao wasichana ambao wako miaka 10 mpaka miaka 15. Sisi hapa katika kaunti ya Makueni tunapeana hiyo chanjo pia katika hospitali zetu. Na nataka kushukuru Wizara ya Afya kwa sababu Makueni County tuko na 235 facilities. Kupitia usaidizi wa Ministry of Health na partners, naweza tangaza ya kwamba zahanati zetu zote zinaweza kupeana services za chanjo. Tuwapigieni makofi jameni. Najua most counties wako 50%, 60% coverage ya immunization services. Sisi tuko 100% today. Na ndiposa hata hili keta zetu ziko juu. Our immunization coverage imefika sasa 93%. Meaning wale hatujapata most likely ni wale wanaenda nje, kitu kama hiyo. Kwa hivyo nataka kuwashukuru kama wizara. Bwana CS, sisi katika kaunti ya Makueni tulianza mpango ule unaitwa Makueni Universal Healthcare.
Tumeambiwa the government of Kenya today under the leadership of His Excellency the President is using what we call one government approach. Na kwa sababu tuko mashinani with all these ngao, national government administrative officers, if we can get a simplified document ambayo inaongea mambo ya cancer, sisi tutakuwa ambassadors wenu na tutaenda katika kila baraza tueleze wananchi this killer disease. Saizi madaktari labda ile logo anatumia kidogo is a bit technical and we may not be in picture to explain. Lakini if we can get a simplified document, I can assure you. And when I say it's applied to what? It's a directive. Senior chiefs. That will be one of your agendas in your public barazas from today. Tueleze wakazi wa Makueni ya kuwa cancer is a killer. But the best medication is to do what? Early detection. So we encourage our people.
Every day, at least 9 women die from cervical cancer, yet it is a preventable disease through awareness, vaccination, screening, and treatment. The Ministry of Health, with the support of partners, is implementing a roadmap for universal health coverage, which has prioritized cancer prevention, screening, and early treatment. Today, Kenya joins countries across the world that are commemorating the National Cervical Health Awareness Month. The launch of the National Cervical Cancer Awareness Week officially marks the start of a week dedicated to intensified awareness creation, vaccination, and screening activities targeting at least 5,000 women across the country. I am also